So, but anyway, I'm honored to be here with you tonight, to be the speaker. And Warren, I didn't realize that the trade-off for this invitation, for accepting this invitation, was having your headshot in 38 issues of the Buffalo News. You know, my friends are telling me that they were glad this event finally got here because they're sick of seeing my face in the newspaper. So, but each year I look forward to this prospectus, the prospectus edition of the Buffalo News, because it gives me the opportunity in one sitting to get a sense of what's happening across various business sectors. I view prospectus as the official start of the business year while providing a great overview of our region's economic climate. I also appreciate the fact that there is it's a reliable local source of information to deliver that oversight. It didn't surprise me to learn that the prospectus is one of the most anticipated and widely read special editions of the year. Warren, congratulations. Before I go ahead, I want to congratulate Warren on becoming the publisher of the Buffalo News. We look forward to your leadership, Warren. Thank you. Before I let me tell you just a little bit about myself. I'm really a dyed-in-the-wool, unabashed Buffalo booster. And I'm very proud of being a Buffalonian. I believe in Buffalo, and I think it's probably the best-kept secret probably the country. I always joke about the fact that when global warming really takes hold, Buffalo is going to be the destination of choice. I've lived in Western New York for 17 years, and it's home now. When I first moved here, my son, my oldest, with tears in his eyes, said, "You have ruined my life." But right now, he is probably, he is a very serious Buffalonian. He loves this community and has committed to stay around. I believe in the strength of community, in giving back and paying it forward. I live this belief in my personal life and in my professional roles, and I've invested time, talent, and treasure in many of our community organizations. Okay. Now let's talk about future opportunities in this new economy and how we as a region will prepare for them. Representing the largest health insurer in the region, and given that one in 3 Americans is covered by Blue Cross Blue Shield, you may be thinking that I'm just going to talk about the healthcare system. We're going to talk about future of healthcare and the implications of the Affordable Care Act and other changes in that industry. But however, you're not going to hear much about healthcare reform or Obamacare or state and private exchanges or exclusively health insurance tonight. It's hard for me not to do that, but I'm going to try not to because I know you've heard quite a bit about it. You probably understand very little about it, and you don't have 8 hours for me to tell you about it. I know that I know, however, that you are now in the company of a health insurance executive, and you want to ask the 2 burning questions. Why are my premiums so high? And why do they keep going up? Let me say 2 things on that topic, and I'll try to move quickly. And I want to try to approach it from a different perspective. First, I said I was proud to be a health insurance executive, and I really mean that because of the role that health insurance has played in ensuring that the majority of Americans have access to health care, access that was not available historically, if you think back about it. Blue Cross Blue Shield is credited with virtually inventing health insurance, just as the country was emerging from the Great Depression. And this laid the foundation for the development of the modern healthcare system in this country. Health insurance was invented essentially because medical care has always been expensive. We needed a mechanism to finance needed services. Hence, we applied insurance principles to healthcare financing. That was a brilliant breakthrough. In fact, one of the first Blue Cross Blue Shield plans started right here in Buffalo. And one of the Blue Shield that you hear so much about was designed in the city of Buffalo. I won't give you the standard commentary about how expensive our healthcare system is, despite the fact that it doesn't deliver outcomes comparable to other developed nations. You've heard all of that. And that never gives you a sense of comfort about rising premiums. Even though premiums rise in direct correlation to rising medical costs. I'm going to challenge you to take a pause and let's think about our cultural attitudes about medical care. I would dare say that everybody in this room, including me, has the expectation that we or our loved ones, if we need it, we should be able to access it. The highest quality care in unlimited amounts and without regard to cost. We believe that. And some of us would even suggest that medical care at these levels is a civil right. We have a right to it, and it should be embedded in the Constitution. Given this attitude about medical care, is there any wonder that our medical costs are skyrocketing? One cynical commentator noted that our medical costs are high simply because we are willing to pay for it. And the noble, compassionate country that we are, we believe that everyone should have it. Indeed, one of the fundamental principles of the Affordable Care Act, or Obamacare as it's come to be known, is that every American should have access to high-quality, effective medical care. And I think very few of us would argue with that premise. But beyond that, it gets political, but we won't go there tonight. This cultural view of medical care leads us as a country to devote a disproportionate percentage of our gross domestic product to health care. You've heard the numbers, $2.5 trillion. By 2020, spending on medical care will reach 20% of our gross domestic product. That means that 20% of everything we produce as a country in our economy is devoted to medical care. No other sector of our economy accounts for that much of the gross domestic product. Not energy, not food, not clothing, and it continues to increase. So when you stop to think about it, that's pretty astounding. But as a country, as a culture, we are willing to spend that much, and we will continue to do it. We will complain about it. We'll beat up on health insurance executives about it every chance we get, but we'll pay for it. We're willing. We are an affluent nation, and we will continue to pick up the tab. Some people will say that this level of spending is unsustainable. I agree with that. But keep in mind that this is what Bill Clinton said in 1994 when spending on medical care was less than $1 trillion. This was what motivated Bill Clinton to produce a health care reform bill that, as you know, was a disastrous failure. I'm neither sounding an alarm nor am I being pessimistic. There is hope, however, that we will conquer this problem, or at least we can make a big dent in the problem. We, the healthcare industry, healthcare providers, and many others have mounted a prodigious effort to bring our medical costs under control. One such effort is happening right here in Western New York. You know, we like to refer to our healthcare system in the United States as a system of care, but we all know that it really is not a true system. We really don't have a true system of interconnected, integrated care. Our, quote, system is made up of independent, freestanding delivery sites with very little integration. In other words, these independent delivery sites don't interact with each other very effectively. So, in my view, I think the first step to beginning to wrestle with our out-of-control cost is to build a true healthcare system. A key building block to this system is the ability to exchange clinical information on a real-time basis. At a minimum, this capability will help to reduce costly duplication and waste in our system. Here in Western New York, we are well on our way to doing just that through an initiative that we call HealthLink. It's a unique collaboration among health insurers, hospital systems, and physicians. And it's one of the first in the country, and it is now one of the most robust in the country. We still have a ways to go, but we're making significant progress. So our overall efforts to try to reduce medical costs, we're making some headway. A recent study by one of the big consulting houses, McKinsey, noted that the rate of growth in our medical spending has slowed for the first time in 50 years. This is significant. The medical trend is beginning to bend. And I think it's a combination of a lot of efforts, prodigious efforts. Well, I said I wouldn't dwell on the medical cost issue, but I guess I just did. So, you know, when I think about medical cost and how much we spend on healthcare, I'm reminded of the old saying that one man's poison is another man's meat. I guess that's the way it goes. You put it more plainly, one man's cost is another man's profit. And I'm suggesting that you think of it that way. The growth in healthcare spending, ironically, makes healthcare a tremendous economic driver in the country and in our region. Consider the economic growth opportunities within our region that are generated by the robust healthcare sector and how we as a community must stay focused on preparing ourselves to take advantage of these opportunities. You know, I mentioned the Affordable Care Act. It requires most Americans to obtain health insurance or pay a penalty. And according to the Congressional Budget Office, this will drive millions of previously uninsured Americans into our healthcare system, driving expansion in opportunities for health plans, hospitals, and other providers. In Western New York, we are estimating that about 150,000 newly insured individuals will move into the system, all needing care and all having health insurance coverage. Couple that with the enormous wave of baby boomers, and unfortunately I'm one of those, who are aging into retirement and moving into a new chapter in their lives. They're going to require a higher level of support and care. Consequently, it will take more individuals working in the healthcare sector to support this influx of newly insured and aging Americans. There will be more demand for research and development of new and better treatments, providing significant expansion and job growth. The most recent jobs report revealed that the healthcare sector added 45,000 jobs nationally in the month of December alone. And this includes jobs in the health insurance and health plan sector. That's well ahead of construction, which came in at 30,000 jobs, and manufacturing with 25,000 jobs. According to the U.S. Department of Labor, the healthcare industry is projected to grow by 5.6 million jobs between 2010 and 2020. That's more than any other industry. The impact locally is no less impressive. Buffalo Niagara Medical Campus is the first that comes to mind. It's an early economic driver in our economy, and it continues to grow. Its current population is 12,000 employees and workers, and it's expected to grow to 20,000 by 2017, with the addition of the UB Medical School and the Catholic Health System headquarters. Health plans expecting to take advantage of these expanded opportunities will require additional positions. As an example, Blue Cross Blue Shield, as we speak, has roughly 100 open positions. Hospital systems will require nurses, lab technologists, analysts, nursing managers, people with bachelor's degrees. And we understand, if some of these here from ECMC expanded its workforce by 100 positions this year. Of course, primary care physicians, more so than specialists, will be needed as consumers seek a patient-centered medical home model of care. This is something we strongly endorse. So, health as a sector is significant in today's economy, and it will play an even greater role in the new economy in Western New York, adding vitality, additional private sector investment, people, and resources to our region. But there remains one issue at hand: people. According to the Western New York's Regional Economic Development Council's 2012 progress report, Western New York has a disconnect between training and education and the job market. Although the region has a high share of mid-skilled workers, I'm quoting from their report, mid-skilled workers and a share of college graduates, Buffalo will face a shortage of skilled workers in the coming years. The 100 openings that we have at Blue Cross Blue Shield are not entry-level positions, nor are they mid-level positions. These are positions that require higher skills, and we're having difficulty filling those positions locally. I know that our local higher education community and the business community are working together. They are aware of this problem, and they're working together to try to fix this disconnect. The Federal Reserve recently issued a report on this issue as well, and they noted a real problem contributing to our unemployment situation. Now, speaking of working together, I want to close my remarks by emphasizing the critical importance of cooperation and collaboration among various sectors of our community towards the goal of creating economic opportunity and the improvement of our community. The Western New York Regional Economic Development Council is a great example of such collaboration across disparate segments of our community, seeking to leverage Governor Cuomo's financial commitment to Western New York, the governor's Buffalo Billions strategy. We are also working together as community leaders, as business leaders, to reform our school system and revitalize our community. You heard Warren speak earlier about Say Yes Buffalo. We are attempting to attack a very serious problem that we have. You've heard the dismal numbers. The city school district is the largest in the region, yet it remains the lowest performing district with a graduation rate of 47%, and that rate is even lower for minority students. And the poverty rate for children in our city is one of the worst in the region and the nation. But opportunity is within our reach because a year ago we launched Say Yes Buffalo, which Warren mentioned, and that we believe will unleash the full potential of this region by awakening the city as it defines us through our children. Our entire community, including business, government leaders, community leaders, have grasped the positive multiplier effect that such a program would create for this city. They understand that the success of this program could have a profound economic impact on our region. It is an economic development strategy. Say Yes, they'll close the college funding gap for every Buffalo public school and charter school graduate beginning this spring. That means that if a student completes high school, economic barriers to attend and graduate from a college will be removed. Now, when we started the scholarship component of Say Yes Buffalo, people asked us, what are you going to do after these kids get into college? How are you going to help them be successful in high school? How are you going to make sure that they show up? And that's when we began to work on the comprehensive supports for students in our community. Those supports support students with legal issues, health issues, social service issues, behavioral health issues, all of those issues that derail students as they try to be successful in school. So we have a formula that we believe will work, that will give students the opportunity to be successful in school and on through post-secondary education. We have we're still in the silent phase in raising money for the scholarship component, but we're up beyond $18 million right now. We expect to achieve an interim goal of $30 million, and we're issuing scholarships for students beginning this spring. Now, there are other programs that fit with Say Yes, programs that have been in the community for quite some time. M&T's Promise Neighborhood project that they've been supporting through the Westminster Elementary School, Choice Neighborhoods, Western New York Women's Foundation, Out of School program. They're all working together now to help reform our school system. And if we are successful in doing that, we believe that the economic impact will be phenomenal. And we know that improved graduation rates, improved education, and improved workforce contributes to the vitality of our community. That is a no-brainer. The expanding and vibrant health sector alone will bring good-paying jobs and great careers to our community, and other sectors will do the same. All of us are stewards of our community. It is our responsibility, I think, to nurture it, help it grow, help it remain vital, not just for our sake, but for the sake of generations to come. that's what we are about. And that brings me to the close of my remarks. And I do want to thank you for your attention. You were very attentive. So thank you. I think now we'll take some questions from the audience, and I'll...
Let's give him a round of applause. Thank you so much, Alphonso. We have some cards on the table if you take a few minutes to fill them out if you have some questions, and we have some questions prepared in advance to kind of get you guys warmed up. Take a few minutes. And so we have some people that will come around and collect those from you. Just raise your hand up if you have something that you wrote down for a question, and we'll get those. One of the first questions that we have is, will Western New York be able to advance economically given the gridlock on issues in Albany and Buffalo?
Gridlock in Albany. I actually am I'm encouraged after Governor Cuomo's election election last year, and he seems to have been able to at least loosen the gridlock and actually get some things done. He's been able to push his agenda forward and get some cooperation across the aisles, and he's been very effective at that. So I'm hopeful that the gridlock will loosen just a little bit in Albany. My sense is that the legislators in Albany are very pleased that they are not viewed as being totally dysfunctional. So I've always said that one of Buffalo's major problems is that it's in the state of New York, and this gridlock issue really points that out. But I think that it's changing, and I'm hopeful.
Great. Well, we know that you are on the board, or many boards actually, but we just had a question in regards to what is the most interesting to you about being on the board of the New York Federal Reserve Bank, and maybe you could share a little bit about what that means for us here in the region.
Well, I actually I was very flattered to be asked to serve. I started out serving as chair of the board of the Buffalo branch of the Federal Reserve. And I'm proud because that is the New York Fed is it's a very significant organization in our economy. It plays a significant role in our economy, and it is viewed as the first among all of the Federal Reserve banks around the country, because it's one of its roles is to execute monetary policy that's put forth by the Federal Reserve Bank in Washington. And that's why, for example, Tim Geithner, who was the president of the New York Fed, played such a significant role during the financial meltdown, because he was president of the New York Fed. And so it's interesting to me because it's also educational, because every month we get a complete briefing from a panel of domestic and international economists. So I have sort of an insider's view of what's going on in the economy. So it's very interesting that way. And the framers of the Federal Reserve Act made it clear that members of the board of directors should be a diverse group of people from diverse geographies around within their district, so that they could have varying perspectives about about monetary policy in the United States. So they're not just looking for bankers and accountants. So it's very interesting.
Well, you talked about the growth of the Buffalo Niagara Medical Campus, and then all of what that leads to for us in the community. And you touched on a little bit about, the need for qualified individuals. And you mentioned, it's a tough time to fill those positions, but I think, can you talk to us more about what can we do here? What kind of programs maybe the schools need to have, or the colleges, or, if there's something that can be done in a combination of partnerships with businesses?
Well, as I said, I think the higher ed community has been awakened to this issue, and they are working with business leaders at the University of Buffalo and some other business leaders to try to address this issue. They realize that they may have been a little bit out of sync with the needs of the business community, and I know that Jack Quinn at Erie County Community College is part of that group, and he's working diligently to bring new courses into his college that are connected to our real-time needs. So that's something that's very encouraging, and they're moving along in that initiative.
So you touched on about health insurance. It's a question probably a lot of people it's on their mind. And I think it's part of the things that Blue Cross and Blue Shield, HealthNow are doing in Western New York, along with many others. But they're talking about how can we change our lives, maybe to lower our health costs as individuals. You have suggestions or thoughts on that?
Well, I do. I have here my Healthy Changes Everything logo. So, but that's part of our brand promise, is to try to help people enhance their lives by being healthier, and do it in a way that's not overwhelming and it's not threatening. And we all know that it's important to be healthy, to live healthy lifestyles. But as you know, it's not that easy. It's easier said than done. And what our efforts are directed towards helping people do that in a very straightforward kind of way. Get more sleep, eat green vegetables, things like that. Exercise, walk your dog. So park in the farthest parking space. Park in the healthy zone, as we call it, which I had to do tonight. So I'm gonna have to leave early to get to my car before midnight.
Well, we might have just one or two questions I see that are coming over here. And 1 second. Thank you. I have a question about Say Yes. Does Say Yes include SUNY schools as well?
Yes. Say Yes does include SUNY schools. Actually, Say Yes uses the SUNY school as a cap on the financial aid. The SUNY tuition sets the cap.
Well, I've got a couple more of those. I think then one of the questions in regards to Say Yes, you touched on it, is what's the effect that you see maybe 10, 15 years, I don't know what the time frame is, really into our economic, state of Western New York and the trajectory and where we could expect it to go?
That's a great question. Because we, as I said, it's an economic development strategy, and it impacts our economy in a number of ways. One is we hope that we will stem the population loss in the city and the region. It'll be an enticement for families to stay in the city or move into the city. In other places, like Kalamazoo, Michigan, which is really where this kind of all started, they've seen some impact in that area. Students who go through the program have a tendency to stay in the region. So maybe it'll stem this brain drain, as we call it. And it also improves the vitality in the sense that students who are more educated earn more money, and if they stay in the community, then they can make a contribution that way.
I think we're just about done with the questions, and I don't know if you have anything to add. I know, Warren, we have something for you on behalf of the Buffalo News. Warren, would you like to come up?
Great. Oh, my goodness. Oh, no. This is great. Oh, thank you.
This is a little something I put in
Oh, okay. Okay. Terrific. Thank you very much.
Thank you very much for coming this evening. Please enjoy the food and safe home.